Good morning. Wanted to welcome you guys this morning to the CF Education Day. My name is Melissa Martin, and as Dr. Karen said, I'm on the Family Advisory Board, and it's pretty much the Family Advisory Board that helps put together days like this for you guys. And so I just wanted to go through and share some information with you. The Family Advisory Board, our mission is to support and empower individuals living with cystic fibrosis and their families in their relationships with the CF centers and the hospitals, to affect positive change by influencing the medical community, educational systems, workplace, and government sectors, to accelerate the rate of improvement in cystic fibrosis care, to be an effective support network for individuals and those around them living with cystic fibrosis day to day. So we typically meet as a group, and the group started back in 2005. And as I said, we started up the CF Education days here that we have. We assist the CF Center with quality improvement projects that they choose to do from year to year. And center policies and materials, we're able to have some input when they're looking for that. During this last year or so, we revised the center brochure back in 2008. We have been helping put together school resources for 504 plans and such as well. And then we have a new patient welcome package and education packet that we helped get created as well. So we were able to have a little input in that as those things were being created, trying to keep in mind what would people like ourselves want to see in those kind of things. Our membership pretty much is, when we're looking for members, is we ask that people are trying to, come attend one meeting a month. We just had one on Monday. We meet at 6 o'clock right at the CF Center for the pediatrics, and we're usually done right around 7:30. Beauty is that we get fed while we're there, so you don't even have to try and eat before you get there. We have a listserv participation, so you're able to email and respond to things in between the meetings. And the one thing that we find is that we constantly have, an evolving group. From time to time, people, are able to really donate their time, and other times they have to back off a little bit just because of things in their own lives. And so we have different members that are coming in at different times and able to help out on different levels. One of the things that we do need, though, for you to be able to be part of the group is to go through the volunteer training that they have there at the hospital, which doesn't take too much. Some of the members that I'd like to introduce to you today, if I could have them stand up, just so as the day's going on, if you do have an interest in the Family Advisory Board, wanting some information, maybe even some interest in joining with us. John Anderson wasn't able to be here today, but we have Josh Beardsley, who is actually right behind the video camera. Kristen LaRochelle, right there. Myself, Melissa Martin. Patty Morris, I saw over there. And then Susan Santamongo, right over there. So these are the current members that we have of the board. One of the things that I think is really enjoyable is that, it is a small group, so we get to know one another. And everybody has different backgrounds. We have different areas of strengths and different experiences with the CF as well. So if you're interested in any level, definitely, during the course of today, if you could, come and speak with one of us and we can give you some more information. Some of the projects that we're looking at doing right now is we're looking at trying to get people trained for being able to do some mentoring with our CF families. The Family Advisory Board is looking at wanting to start doing a website for the patients and the families. That's a new thought that we have that we're trying to see how we can get that up and going, and it sounds really exciting. Another thing that we're looking at that we've been in the discussion about is trying to get together some information for our patients when they're getting ready to attend a hospital stay for the first time. What are those things that you should know that you need to bring? What are the things that just that information that you wouldn't know until you've had that experience? Today, some of the breakout sessions that you saw as you were signing in, we have age-related groups for infants and toddlers, school age group, an adolescence group, and a group for adults. We have a group that's going to discuss high-calorie cooking and probably some of those recipes and things. Impaired glucose tolerance, that's an area that we found we've had some parents just wanting to have some basic information about where they know that that is related with cystic fibrosis. We have a lady from the mentoring program here that is going to have a group herself to let us know a little more information. And then we also have Stacy from the CF Foundation for raising money and being able to discuss different ways that you as yourself can try and raise money for the foundation. So just at the bottom, as Dr. Karen said, is those are out where you guys signed in. So if you can make sure that you signed up for 2 choices. And if you haven't had a chance to do that, if you could do that in just a little bit, that would be wonderful. And so now I will turn it over to the physical therapist.